Hello dear patients, today we are going to review such topic as erosions in the lower abdomen, in the groin in a woman. A woman came to our clinic. She was the wife of our patient. She had hormonal therapy from gynecologist to conceive a baby. She couldn't get infected by some infections, as she and her husband were examined before conception. So several erosions appeared, you can see them on the picture. This scared these patients a lot, as they were trying to conceive a baby. On observation we see slightly painful erosions in the groin area. The most important thing here is to exclude sexually transmitted infections, herpeses, including first and second types, herpes zoster. Scrapings from the surface of erosions were taken for that. PCR analysis. Scraping for syphilis was added there just in case, as anything is possible. Secondly, culture test for bacteria with sensitivity to antibiotics was done with sensitivity to antibiotics. So what were the results here? There were no sexually transmitted infections, including different types of herpes, but streptococcus was present. This was streptococcal impetigo. Impetigo is basically a penetration of streptococcus into superficial skin layers. As a result of that, blisters form. They can be invisible as they explode. You can watch a separate video about streptococcal impetigo on our channel. The unpleasant thing was that hormonal therapy facilitated the appearance of this disease. It was indicated for this patient for conception, so it couldn't be cancelled. Prescribing internal antibiotics was also almost impossible, and it was also not desirable to prescribe some other medications. So we tried prescribing external therapy for the beginning. Zinerid solution was prescribed. Ointments with antibiotic by type of levomicolum were prescribed. Lubricating by salicyl alcohol was also prescribed. As a result of that, in 4 or 5 days these erosions completely resolved, and in 10 days it even became difficult to notice them by the eye. This case indicates that hormonal changes, both provoked by gynecologists as well as hormonal changes during conception, often lead to decrease of immunity, multiplication of potentially pathogenic flora, to which streptococcus is also related. Here, although I'm against prescribing external therapy only, in the majority of cases it's not enough. But when the choice of medications is limited, we need to try it, of course, so that not to harm a future child. So, in this case, fortunately, we were able to induce healing by the patient without using antibiotics and other medications internally. If it is necessary to diagnose and treat different skin lesions and rashes in the area of sexual organs, you can consult dermatovenerologists, gynecologists and urologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such neoplasms and rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.